Okay, and we should be live. Hi, everyone, and welcome back to another session with DentalShadowers. We are very excited to welcome our guest, Dr. Porcher-Fennell, a general dentist practicing in Nashville, Tennessee. Doctor, thank you so much for taking the time out of your busy schedule to meet with us today. Please feel free to take it away whenever you're ready.
Okay, thanks for having me. I hope that you guys get some great information out of this, and I welcome any and all questions.
Awesome, I'm excited. So yeah, feel free to take it away.
All right. So this is my introduction. So I thought instead of me putting what school I graduated from and a little bit of background information, that I will actually pose a couple of questions for you guys to think about in terms of what you want to do with your career. So I put, why do you want to become a dentist? When I decided to become a dentist, I decided in college. So this wasn't something that I wanted to do as a kid. So deciding it in college obviously was something that was challenging, but I was able to decide that and then start to pursue some things in dentistry. So that's pretty much how I got started in the dental field. And then I also asked what motivates and drives you, because becoming a dentist is more than just doing people's teeth, doing veneers that you might see, all the cool things about dentistry. It takes a lot more than that. Does money drive you? Because sometimes working in dentistry, it doesn't bring in a whole lot of money, especially depending on what field you actually go into. So don't let money be the only reason why you choose a certain career. I would say that. What are your passions? What are things that you are passionate about? Is dentistry something you're passionate about? I personally have many different things that I enjoy. I enjoy cooking. I enjoy watching some reality TV. So what are some of the things that you would like to do that you wouldn't necessarily have to be paid for, but you love doing? So just think about those things. Where do you see yourself in 5 years? Let's say you have a goal, you want to get into dental school next year, you want to finish school, you want to do residency, kind of have a path or a goal of what you're trying to achieve. Which brings me to my next one. What are your short-term and long-term goals? What are some things that you are able to do? Sorry guys, I have children, very small children, so you will see them pop in and out. I try to be as professional as I can, but I have a 2-year-old and a 4-year-old, and we will get into having children as well if some of you guys have kids out there. But yes, short-term and long-term goals, those are really important because that kind of gives you a timeline. So I like to tell people, don't kind of put yourself in a box. Oh, I want to be married by 25. I want to have kids by 30. I want to own, a whole bunch of property by 35. Don't try to limit yourself age-wise. You want to be able to make sure that your goals are attainable. So don't try to put time limits on them, because sometimes it may take you a little longer to reach a short-term goal that you thought might have taken you maybe 6 months to a year. And then where do you want to go in life? That's figuratively and literally. What do you want? What your goals and your aspirations kind of take you different places. So think about where you want to be at the end of the day. Who do you want to be with? What is it that you most want to do? And then what do you most want others to say about you? When I think about being a dentist, I don't just want people to say, "Oh, she was a good dentist," and nothing else. I want people to say she inspired me. She allowed me to see some things in myself that I didn't think I could do, or I didn't think that it was possible. So you really want to be a motivator and an inspirator for other people, other than just what you do as a career.
Right. Awesome.
Yeah, so I'm sure everybody could see my little guy, Darrell, where the money resides. So where do you want to be? You, like I said, that is something that you really have to think about when you are pursuing certain things in life. So what does it take to get into dental school? So definitely you need good test scores, GPA, extracurricular activities, and I put personality on there. I was a person that my test scores weren't necessarily the highest, but they weren't the lowest. So I feel like a lot of that had to do with how I interview and my personality. And so being a dentist and especially owning a practice, you have to be a personable person to to reach your patients and to and be understanding. So you want patients to say, wow, she really connected with me, or he really connected with me. So those are just some things that you kind of have to keep in mind as you are trying to apply and trying to get into dental school. So don't weigh heavily on test scores or GPA, because that's not the only thing that gets you in. So that's just one part of it, but just make sure that you are you kind of have a total package to everything that you want to do. So, and you only need one school to say yes. So it's not like you need like 10 acceptances. You just need one. So just keep that in mind as you are thinking about going and applying to dental school. So for my dental school journey, I applied my junior year. I taken the DAT twice. I had some schools that wanted me to take it a third time, and I just decided that I wasn't going to do it because I had already had a couple of interviews. So I was just like, well, I'll just take my chances. So I interviewed, and I was offered. I wasn't offered. A position quite yet. What they did was they have a post-bac program. So some schools have what they call post-bac programs, but they've turned them into like maybe mini master's programs. So it's just a year before they allow you to enter into the class. So maybe you need to get some more biochemistry or microbiology, some of that. So you're able to complete that year, and once you complete that year, usually you can get into the starting class. But I was waitlisted for the post-bac program after I interviewed. But then they called me and they said that they had a seat for me in my class. So for me, I'm a person of faith, so I believe that our steps are ordained. I believe that nothing happens by chance. And so I know that it was a higher power that was the reason why I got into the class at school, and I skipped over the post-bac program. So I don't take that for granted, because I know that I didn't necessarily have to be in that class. But I was fortunate enough to do that. So that's a little bit about my journey in getting into dental school. Okay. So I added this slide. I like this little girl. She said, worry about yourself, because sometimes and it may not happen to everybody, but you have to have a good support system when you are pursuing this type of degree, any type of professional degree or higher education. You have to have a good set of positive people around you. You want positive energy, nothing negative. So there could be a lot of people that may say, oh, you think you're going to get into school, or you're not going to get into school, or you want to go to Harvard, or you're not good enough to go there. And so obviously those people, you shouldn't want to share your goals and your dreams with them, because they don't believe that you are going to do what you say or you believe that you're going to do. So I just want to tell you that you don't have to worry about other people and their perception of what you're going to do you in life and where you're going to go in life, because nobody knows that other than yourself. So I just want everyone to stay encouraged during this process, because it can be a very stressful time and a very difficult time. Sometimes you may get some denials or no's, and that's okay too, because like I said, you're not meant to be everywhere. But just genuinely have people in your life that will support you no matter what. Next. So for me personally, because I attended Harry Medical College, that was the best experience for me personally. I learned so much when I was there, and somebody gave me the opportunity to be there. So I did not take that lightly. And so when while I was there, I soaked up everything. I met unique people. I made friends with not actually they're my colleagues now, but some of my professors that, like I said, are now my colleagues. So you really do make lifelong friends there. Well, just in school in general, even in college, like I said, some people have met lifelong friends, but you also do the same thing in dental school. So some of the things that you may felt that you missed in undergrad, you can absolutely get them in dental school. So this is some of the things that I want you to consider when you are applying to dental school. Is the location, do you see yourself being there for 4+ years? So like I said, sometimes, if you get into a post-bac program, or, what happens if you get sick and you have to like medically get out of school for a year and return? Can you see yourself living in that city for like longer than 4 years? So that's one of the big things. I think location is really an important part of where you go to school, to residency, to work. It really is an important piece of a lot of different things. So is the curriculum solid and up to date? So do they have the latest technology with CIRAC? Are they placing implants? Do they do Invisalign, or do they offer that? So this kind of looking at that to kind of decide, okay, is this dental school good for me? Is it not? Is that what I'm looking for? Do they have what I'm looking for? So that's what kind of helps you to decide that. And then, is it a feeder school for a dental specialty? So what I mean by that is some dental schools are known to send their graduates to certain programs just because, and they may not necessarily name it as a feeder school, but they're known for sending their students to a specific specialty program, whether it be orthodontics, whether it be pediatric dentistry, something along those lines. So you want to make sure that if you are looking to specialize, and then you want to go to a school that will help you get into that specialty program. And then another thing is, if cost wasn't a factor, would you still attend? So I've had some people that reach out to me that really talk to me about that, because when I ask that question, they're like, well, USC is super expensive, but if I get in, I still want to go. Okay, so that means cost isn't a factor. But for some people, they may want to only go to a public school because it may be cheaper than going to a private institution. So that is a personal thing that you have to decide how much debt you're willing to get into. If you don't have to get into debt and you have somebody that can help you through school, that's great too. So just think about those things as you are trying to apply to dental school. And that's my picture. I took that picture the fall of the year that I graduated, or the year before I graduated. So that is I looked a lot different. My hair was different, but that was a fun time. We all went to get our makeup done, and we just sat in there, combed our hair. Everybody had their hair combed. And we just wanted to take some great pictures. So that was a fun time. So I talked a little bit about residency, but if you decide you want to do residency, it's not bad. I recommend for all students to consider that. When I graduated, I did a general practice residency. So I did it at the Veterans Affairs Administration in Memphis. They no longer have that program. I think I was like the second to the last group of students to go through that program. But regardless, I feel like if you can do a general practice, so you decide you don't want to specialize. Okay, so you can do a general practice residency, or you can do an advanced education in general dentistry. It definitely will strengthen your skills um, throughout everything. Yeah, so um and I mean, some specialty programs like that, you go to have a GPR or AGG, just because it gives you a little bit more well-roundedness that they look at. They don't frown upon people that may have been working in general dentistry before they decided to go back and specialize. So don't think you necessarily have to decide when you are in dental school that you have to specialize, because you don't. You may want to get out in general practice, and then you say, oh, this is not for me, I rather specialize. That's fine too. So that's why these residencies, give you the freedom and the options to be able to decide that. So my residency, I placed implants, I restored implants. Working at the VA, I didn't have to worry about the patient's ability to pay. So that was one of the reasons why I chose to go there, because the patients, I could pretty much do the top-notch best treatment plan for the patient without having them ever having to worry about, oh, I can't afford this implant, I can't afford this bridge, or anything like that. So that was an important aspect of the residency that I wanted to gain from it. But I also didn't know, when you go to hospital-based programs, you can't put your loans in deferment. So that's another thing to think about, because the hospital wasn't affiliated with a university. I was unable to do that. And so my loans accumulated more interest when I was in residency versus if I had gone to a university program, I could have kept them in deferment. But that wasn't a huge deal breaker for me. So like I said, I don't regret where I went, but that's just something to keep in mind as well. So I have to talk about the workforce, because I had my situation was a little different. So when before I graduated dental school, I got married. And so when I went to residency, I was married. And so when I came back to Nashville, I started working as a full-time faculty member at Harry in the restorative department. I really enjoyed my time with the students, and I was a clinical instructor, and then I also taught in the classroom. So it gave me a little bit of a different, a kind of a balance of being able to help the students, but also do my clinical aspect of some things, because when students get in a bind, we have to help them. And so I really enjoyed that. I loved working there. Like I said, it's almost like coming back home when I went to work at Meharry. But I knew that in order for me to grow clinically, I had to kind of get from my comfort zone. So we oftentimes want to be somewhere comfortable all the time, and that doesn't serve us, because we won't grow if we're always comfortable. And so I took a job working for a community health center, and they offered loan repayment. So the National Health Service Corps, that was one. It was definitely an experience, I can say that. So it was definitely different than something. I don't necessarily say a lot of jobs, it does depend a lot on the management and how it's set up to where you can be the best employee that you can be. But I learned a lot from that, working with community health. Of course, those were individuals that most of them were either low income, they were either in rehab facilities because they had some type of drug addiction or alcohol addiction, and they were in halfway houses. I saw people that were in adult living facilities. So some of them could not communicate, they couldn't talk, so that meant they couldn't sign consent forms to get treatment done. So I had to deal with the wherever they live to get that done. So it was a lot of different layers to working in community health. And like I said, it's not all bad, but you just have to take certain lessons with you, wherever you go, wherever you work. And so once I left community health, I decided to purchase a practice. So I purchased an existing practice here in 2019. And so obviously 8 months into me owning the business, COVID really hit. And so it made it more difficult, or I can say challenging, to say the least, to try to still maintain and be open, and still provide care to patients throughout this this COVID season. So that has been challenging, but now I have the practice, and then I'm also still teaching at Meharry as an assistant professor. So I did go back to Meharry, and so like I said, that's always home for me. So I did go back there, and I'm still there. And I will be on another venture pretty soon, working with working with nursing homes. So it's another type of community health job that I will be doing at some point in time as well. Yeah, so that's my little Dr. Seuss thing. He's very cute. Teeth, they are very much in style. They must be very much worthwhile. So I'm sure a lot of people, they say that's one of the first things people look at when they meet you are your teeth. So, I mean, teeth are really, really important for a lot of people. It gives them confidence. It could help them get jobs, being in relationships. So teeth are very, very important. So at my office, we get into a little bit of what I do. So the benefit of being a general practitioner is that I don't have to do everything. So in my practice, I don't offer root canals. I refer those out. I refer out some pediatric cases that I may not want to deal with. I do like working with children, so I don't have a problem with that. But like I said, the more difficult cases, I will refer to a pediatric dentist. I don't do orthodontics in my office either, so I do refer orthodontists in my office. But some services I do offer. I do Botox and fillers. Yes, dentists can do those. If you take advanced courses, you can do Botox and fillers. Teeth whitening, crowns, veneers. I do extractions, partials, dentures, bridges. So I am still along those other lines, but trying to streamline more into the cosmetic realm. Once you get into the cosmetic realm, though, it's a very intense, because patients really expect a lot aesthetically. And when I say aesthetic, I mean look wise. So, we're out here competing with the Nene Leaks veneers, or, some people, who you see in a magazine, that's what people bring into the office and say they want to look like. And unfortunately, I mean, there's a lot that can be done, but everybody's smile is unique. So you can't promise that people will look like certain celebrities or certain things, because that's just not possible. Everybody is individual. So you have to go case by case with that type of situation. So typically a dental office is set up where you have a front desk person, you may have an office manager or coordinator, you have a dental assistant, a dental hygienist. I recommend having a billing or insurance manager or insurance coordinator, somebody that's very, very familiar with dental insurance, because if you decide to take insurance, that is one thing that is the worst. It will give you the worst headache in the world. So my office is a little unique. So I do not have a hygienist. I clean all my patients. I don't have an office coordinator. So most of the time, my assistant, she doubles as my front desk person and my assistant. And then I handle all of the billing and the insurance stuff. Is that ideal? No. Is that what I have to work with? Yes. So I do that. And that in itself, doing billing and insurance, that's a whole nother job. So when we talk about entrepreneurship, owning a business, I hear a lot of people throw out like, oh, if you don't have an LLC, you don't set up an LLC. First of all, everybody is not an entrepreneur. Everybody does not have to own a business to be successful. And it is a lot of hard work. So I'm impartial. So, I've seen all sides of it. And I know what works and what doesn't work. But definitely, if you decide to own your own business, you have to have a lot of help, and I mean good help, not just somebody that's sitting and filling a space, but I mean like actually good help to help you do things. And so again, I kind of touched on that. So I do accept insurance, but I do not accept Medicaid or HMO plans. So all the plans I accept are PPO, which means that usually the PPO plans pay out a little bit more than the Medicaid plans. But if I had a choice, I would prefer to be fee for service. That's what that FFS is. So basically, that means that whatever my usual customary fees are, that's what the patients would pay. So they will pay my full fee for whatever treatment I provide. But when you take insurance, you basically negotiate with the insurance to take a lower rate other than your fee. And so, it takes years to do that. Dropping insurances, and of course, a lot of patients that have insurance want to go to places that accept their insurance because they don't want to pay out of pocket, because every month they're paying their premium for the insurance. And so, I understand that that makes sense. And so, but that also, like I said, goes back to location. Some locations, patients wouldn't mind paying your fee because they understand what you do and they respect your craft. But unfortunately, it's not like that everywhere. So some people they just want to pay what they just don't want to pay anything if they have insurance. And when they find out their insurance may not pay all of it, they don't want to pay what the remaining balance is. And so, you just have to decide that for yourself, what you want to do with that. So I am terrible at taking pictures of my cases. I've done a lot of cases that after I finished them, I would be like, I should have got pictures. But yes, all patients gave me permission to be photographed for this, and I just get into the cases so you can kind of see what what I kind of do. It's important in school that you learn how to document your cases, because when you document them, you can actually show other patients what you can do. So then they're more likely to accept your treatment plan when it comes to if you say, oh, I do veneers and here's what my veneers look like and they look great, and the patient sees that, obviously they're going to buy into that, which there are programs and stuff that people do, smile makeovers and everything, so people can see it without you having to do that. But it's still good to document your work that you do personally. Okay, so this is a first case. So this is a Botox patient of mine. She was curious about Botox. She never had anything done. So as you can see in a before picture, she had She had glabella lines, she had crow's feet. So she had she wasn't as bad in her forehead area. So where we treated was just the glabella lines in her crow's feet. So you can definitely see the difference in the second picture. So it did make her look more youthful. What I do say is I can't promise what you will look like. You know, I don't know how your body will react to this. But Botox is just a temporary way to fight lines and wrinkles, basically, because it reduces the muscle movement underneath your skin. So that's basically how Botox works. But she was very pleased at you know, our results, what it turned out to be. I was pleased with them. So she was a good case to work with. So my second case, this was a man that came in and he suffered from severe GERD. And so obviously when people have GERD, they, you know, the acid in their stomach, when they regurgitate it a lot, it can erode the backs of their teeth and just teeth in general. And so he only cared about restoring his front teeth. So that's another thing you would deal with as far as dealing with patients, because some patients just want what they want. They don't care what your recommendation is. Obviously, sometimes you can say, well, maybe I'm not the provider for you because, you know, you don't want to agree to what I'm telling you to do. So I never make a patient do what I want them to do. I kind of talk with them and kind of meet them where they are, but also stress the importance of why I'm telling them they may need certain things. And so he agreed. It's because I was surprised that I could even get him to agree to do from K9 to K9. So he ended up doing from K9 to K9, which I really want to do a full mouth rehab on him, but obviously, due to financial reasons and some other things, he just really cared about those six teeth in the front. So he was pleased about it. Aesthetically, it was okay for me, but I wanted it to be a little better. But because we had certain restraints dealing with his occlusion and other things, we did the best that we could with that. So definitely his smile improves. You know, that improves his overall health. He can eat, and you know, he's more happy with his smile. So if the patient's happy, then I'm happy. So this was a patient. He is also a veteran. Unfortunately, some veterans, if they don't have 100% disability, they cannot receive dental treatment. And so he came to see me in the office, and he had so that is a denture that he has that's been worn down. It was sliding out of his mouth. You know, it didn't fit anymore. He was embarrassed about it. You know, and so when he came in, we redid his denture, and you see on the other picture, he's grinning from ear to ear. So he loved it. It was a great case. It looked natural on him. So dentures have come a long way from what they used to be. So I was pleased that he was able to love his smile again, and we could do a denture for him. So this is one of my whitening cases. And so typically, if a person already has fairly white teeth, if you whiten them, they won't get any whiter than what they are. And so he was a good case because he was kind of in the middle. So you can definitely tell the difference between the two. I use a gel in-house. I don't do a Zoom or use a light. If you don't do certain things with those patients, they can have a super sensitivity. And I don't want people calling me saying their teeth are super sensitive, they can't eat, they can't drink anything. So what I use in the office is it is stronger than what you can get over the counter, but I'm able to get the same result with it without using a light. And so he was very pleased with his smile. So this is another denture patient that I had. He was a really nice gentleman, but he only wanted an upper denture. So sometimes you think to yourself, like, well, what are you going to do with only upper teeth? Like, he had no bottom teeth, but he didn't want bottom teeth. He only wanted an upper denture. So I made him an upper denture. And looking at him, I mean, you probably couldn't tell that it was a denture, but that's what it is. So that's what I mean by, when you work with a good lab and you can do things, I mean, you can create something that looks natural and not bulky in the patient's mouth. So this was a case where the patient had, he had a history of smoking, high caries. He wanted to change the spots on his teeth. And so he wanted it to look more natural. So what I did was I just kind of created the look with composite. And I just kept building on top of it to kind of give him like an overall more natural look. But obviously for someone in his case, he will probably need veneers or crowns at some point, just because the composite over time, it wears down. So you would have to keep replacing it, especially since he was still smoking. So I could see that the composite would probably change color over time. So but in the meantime, that really helped him because he was trying to get his life back on track. He was in a halfway house, but he was doing better. He had a job. So we were just trying to help him maintain his dental health so he could stay at the job, he could stay working, not be in pain, and get his life together. Okay, so this was a lady that came in and she told me that she did not want any removable appliances. So you will have some patients come in and say, I don't want a denture, I don't want a partial. What can you do for me? Blah blah blah. Um, the front teeth were um very mobile. She had periodontal disease, all of that. So we really had to extract those teeth, and then that is a 9-unit bridge. I will not recommend to anyone to do a 9-unit bridge. That is a lot of teeth that you have to replace. But she was not willing to get anything else. And so as you can see before the after result, the bridge turned out to be very good for her. She loved it. She didn't have any post-op pain, anything after extraction and us doing the bridge. So like I said, this was challenging, but we got through it, and she is doing well with it. And so I wanted to share with you guys that I actually was inspired to write an ebook about my experiences. So what I talk about here is not in is something totally different in the book. It goes a little bit more in depth about my experience and how I got through some things and how I chose to do some things. And so if you guys are interested, you can check it out, purchase it at the link, and you won't regret it. And so I hope that you guys got something out of this. Getting into dental school, it is very, very stressful. But if it's really what you want to do, I mean, I say do it to the best of your ability. Find people, like I said, that can support you, that believe in what you're trying to do. And just get it done. And live your life to the fullest. Don't try to do things that are not serving you, or you feel unfulfilled. Please do things that you are put on this earth to do and to make a difference. So don't waste your time, but be mindful of your time, and make a plan, make some goals, and reach them. Okay. Thank you guys for listening.
That was great. Wow, doctor, that was, I think, incredibly comprehensive and incredibly insightful. I actually, in fact, I think I actually really appreciated I think it was the fifth or sixth slide, in which you talked about the naysayer characters that sort of present themselves in our lives. And I think we often, overlook their potential impact on our lives, on our sort of motivation, well-being, and even our mental health. And I thought that was huge and pretty impactful. So thank you for sharing. But at this point, we'll hand it off to our chat moderator, Yoon, so we can answer a few questions that were submitted by our viewers. Yoon, feel free to take it away.
We do have a couple of questions. I guess the first one is, how did you maintain a positive attitude while schools were saying that you need to retake the DAT?
Well, as I mentioned before, I'm a person of faith, so I pray about everything. Before I do everything, I pray about it. And I was just like, the scores that I have will get me somewhere. So I just believe that, and irregardless if I didn't get it and I had to redo it, I still had another year, but I was determined not to give up on myself. So sometimes you have to be your own encourager and just say, I did it. I did the best I could. This is what I have to offer you. If, like I said, somebody will be willing to accept it. So don't give up. Just keep going. Keep trying to study. Like I said, you can only take that test so many times. And I mean, it's already been proven that standardized tests don't really tell them anything about a person or their ability and what they can do. So you just have to be in the right position and the right people looking at your application, to make sure that you are able to get in. So I wouldn't weigh heavily on that because, like I said, it's more than just a DAT score, but I just kept going. I just said, well, that's what they want. It's 60 other schools that I can apply to, so just keep going.
It's very inspiring. Another question that we have is, what extracurriculars did you do that helped you get into dental school?
I don't know if I did a particular one that got me in, because now people don't have degrees in biology or chemistry. It's people coming from social work, I mean psychology, so it's different background. So now they're more open to it as long as you have your prerequisites. What I did was I shadowed about 5 different dentists. So when I didn't go home per se during the breaks, like spring break and fall break and stuff, I either was doing research. So I did a lot of research because I had to do a thesis in undergrad. So I was either doing research or I was shadowing in some specialist office in general practice offices. So I was really just trying to get as much information and background on dentistry as I could. And so those are pretty much I mean, I did volunteer because I was in the honors college. So we had to volunteer. So I did some types of community service. It wasn't necessarily geared towards dentistry, but if you do something along those lines, I mean, as long as you're not sitting on the couch at home, and you do something that is meaningful. If you go out building houses, or if you go and you visit a nursing home every week or something like that, that is something that you can put on there that they can see that you are involved in your community. So don't kind of get hung up on doing things specifically for dentistry, because it doesn't have to be that way.
Next question that we have is, what is something you wish you would have done differently during applications?
I don't know if I would have done anything differently. I'm not really sure if it's a different criteria now or anything like that, but I applied to 9 or 10 schools. I took the test, I had all my letters of recommendation. Um, so I don't really have anything that I thought that I could have done differently that would have made my getting into a different school or anything like that. I don't really have anything I thought I could do differently.
The message is to just be prepared going into this.
Mm-hmm. Yeah. And I mean, for me, preparing, not just the application, but preparing for the interview, I had one-on-one interviews, whereas when I practiced for my mock interviews, I had a panel. So sometimes you just have to be prepared for, whatever you're going to walk into. And so I wasn't prepared for, so I guess that's one thing, it's not application, but maybe interview, was that I would have prepared one-on-one with somebody versus in a panel. Because when you're on a panel, of course, you get questions from this person and that person, but it's multiple people in there. So it's different when you're one-on-one with somebody. So it's more like an intimate type of situation. So those people can really kind of read between the lines because it's you and that person. So that was different for me.
The next question is, how long was your residency?
Just a year.
A year. And can you speak more about your loan repayment program? Like, how did you apply, or do you have any say as to where you are placed?
Well, I did the National Health Service Corps. And so I'm talking to the people. Can you let me talk to the people? Well, I'm gonna let mommy finish, okay? Thank you. Okay. Okay. Okay.
Dentistry attracts all ages. So
Sorry, I told you guys my kid.
no worries.
Okay. So yeah, so my National Health Service Corps, that is something you can look up online. They do have a program where you can do it 4 years, like in school, so you can apply to it before you get into dental school, or you can apply to it after you get out of dental school. So I actually applied to the program when I was a sophomore in dental school and a junior in dental school. I didn't get accepted to the program. I had classmates that got accepted like their freshman year, so they had everything, paid for. And they just had to go work at, a site, whatever site that they assigned to them, to repay their time. But what I did was, once I got a job with the community health center, I applied that way. And typically it goes off of how high the HIPSA score is. So basically they give a score to each a community health center based on, I guess, how many people they see for Medicaid, different things like that. And so of course I think it's the higher the number, the more likely you are to get the funds. And so I got the funds because of the community health center, but at the time it was only 50,000. I think now they offer up to 120,000 for that, but you have to give 3 years back. For the 50, it was 2 years. And then any years after that, you only get $20,000 if you reapply to get into it again. So again, that depends on. So you definitely have to either have a job working in one of those HIPAA approved facilities, or you have to accept the job and will be working by the time that they recommend for you to be able to get that money. But that was one of the things in hindsight. I probably should not have done that because when you work in community health, as I said, some things in dentistry, you're not going to be balling out of control. So, of course, with community health, they don't pay you well. So I still had to pay my student loans as I was working there, even though I received that $50,000. And because of the amount of loans that I had, that money only covered the interest for 6 months. So really, in hindsight, it didn't matter, because it didn't touch anything on my student loans. And so, like I said, you really have to be a saint, to work, to want to work in community health and some of those other places where you're not going to be balling out of control. So it's just really up to you.
And the next question is, what are some reasons that you got into looking at owning your own practice? What are the pros and cons of owning your own practice?
I think I talked about a lot of the pros and cons. One of the cons for me is I don't have enough staff. And even when I try to have enough staff, they are not faithful. So it's like, as nice as you try to be and you try to treat, your staff, a lot of them really don't stick around that long. And so, I think back in the day, when the older dentists got assistants and hygienists, they stayed with them for 20 and 30 years. These people out here not staying with you for 20 or 30 years. If they can find a job making more, and being an owner, like for me, I don't offer health care. I don't offer health insurance for my employee. I don't offer her a 401k or anything like that. So you have to think about, the competition is not just with other dental offices, it's with corporate offices. They can offer them things that I can't offer. And so that is a con. Like I said, not having, a pro, I guess would be, you could semi-set your schedule. So a lot of people say, I go into dentistry for the work-life balance. I don't think you reach a work-life balance until you actually have been working maybe 10 years or 15 years in your own practice. Maybe you could find work-life balance being an associate in somebody else's practice if they pay you well. But technically for me, it's like I can set my schedule, but not really, because I have bills to pay. So if I'm not in the office seeing a patient, I don't get a paycheck. And then I have to worry about, if I don't have money, still have to worry about making payroll, which means I still have to pay my employees that are working for me because they're not working for free. So that's a con too. I don't like having multiple people depending on me for their livelihood. That's a big responsibility to have to deal with. And so for me, that's one of the biggest things. Like I said, entrepreneurship is not for everybody. Owning a practice is not for everybody. And it doesn't shut off. So at the end of the day, I still have to deal with it. I just can't go home and cut the light out and say, oh, I'm done with the office for the day. Like it's an ongoing thing. So if that's something that you don't want, if you want to go to work and be able to go home, to me, that's more of a work-life balance, because I'm not bringing anything home with me, and I'm able to just relax or, just kind of cut back, and I don't have to deal with a lot of the things that I have to deal with being a business owner.
Just to sort of segue off of that, how did you adjust to, I guess, the managerial aspects of running a private practice out of dental school, out of residency?
Well, I did it a little bit after, but fortunately, my mother was an HR manager. So I had, she would always tell me, if you treat your workers good, they'll treat you good. Or if you get down in the trenches with them, and they see that you're willing to do things, with them, then they will be good to you. And so I had those concepts in my mind already. So I pretty much knew, and I know that a lot of people, they don't leave jobs, they leave management. So that was one of the reasons why I left community health, because in particular, that particular job that I had, the management sucked. And so that's something that's important to me. So, dealing with that, and then on top of, so one of the biggest things that I just didn't, I wasn't familiar with was hiring and firing people. That's a hard thing to do as well. So when I lost my first office manager and I had to hire a second office manager, I was on Indeed. I had to post, stuff on Indeed to find a new office manager. I had to look at a whole bunch of resumes. I had to, schedule interviews. I did all that myself. Now, of course, like I said, when people have other people working for them, they could delegate, those things to the office manager or office coordinator or something like that. So you may not necessarily have to do all of the HR things, but you can delegate it to your staff. Well, that staff was me, so I had to be the one to do all of that. So like I said, having the experience of my mom being in HR, I just kind of knew certain things. So if I didn't know something, I would just call and be like, hey, what's the law on this for an employee? Because again, you got to remember, you are an employer, so you have to follow the rules. So these employees can go and they can say, oh, I didn't get workman's comp, or I didn't do this or do that. So I think that's a little deep for y'all, but just know, it's not, it's more than just the business and just that. It's a whole lot of other things that come along with it.
Right.
I guess branching off of that question as well, how difficult is it managing your family life and your work life?
I mean, it's with two toddlers, you just saw her hand on my face. So when I get home, my work is not done. Even if, I may bring some things home, I try to be as present as I can. I am tired. But I do have an amazing husband that supports me in what I do. And so he does take on a lot of the home, responsibility sometimes with the girls. I mean, we are partners, and we try to work with one another so that nobody feels like they're carrying the weight of the relationships and things that have to be done. But it is challenging. Anything, a marriage is challenging. Once you bring kids into it, that brings in a whole nother can of worms. And then on top of that, having a business. So that's why I said at some point, but I think it's further down the road, not necessarily in the beginning, you will graduate to having more of a work-life balance where you can maybe work 3 days a week and be able to spend more time with family and different things like that. But in the beginning, it's very difficult to do that and still try to grow a business.
Yes, the last question that we have for today is, how did you get into Botox and dermal fillers?
One of my colleagues was doing it, and she said, I think that would be good. You could get into Botox and stuff. So she told me the course that she took. So I looked up the course and I took that, and I had my live patients and I did it. And I kind of liked what it was. I mean, you can get results from it. That's something that you don't have to. You're not going to charge insurance because, of course, it's cosmetic, so that's cash money. So anything you could do in your practice that you don't have to deal with insurance is like top notch. But you got to have the clientele for it. So that means that area wise, you have to figure out, okay, is my area an area for Botox? So that's how I pretty much got into it. It was just a colleague that said, hey, you should do it. And so I just took the class and I started offering it in my office.
Very interesting. I guess on that note, we'll go ahead and conclude today's session. Doctor, that was fantastic. We'd like to thank you again for your time, and we'd like to, I guess, wish you a productive year.
Yes, well, thank you.
Absolutely. And just one last thing to our viewers, to our attendees, just a reminder that the quiz for today's session will be posted in the chat, and it can also be found in our Instagram bio as well. On that note, we'd like to wish everyone a good evening. Thank you again, Doctor.
You're welcome. Thank you.
All right. Take care.